I was diagnosed with triple negative breast cancer. To begin with, it didn't occur to me that I would actually get it. I always didn't link it because none of my family are being diagnosed with breast cancer. My name is Li Ping. I'm a mother of 3. I was diagnosed in early of 2020. It actually started mid of 2019 when I discovered a lump. But I actually took it quite lightly then. I have actually received a few false alarms earlier on. I do annual screening every year. So on and off, I do get this, your mammogram report is not clear, you have to do another round of tests. So I thought, okay, this is going to be another false alarm. It's quite shocking actually. I mean, emotionally, I thought I am a pretty strong person. But when the news came in, it is quite difficult for you to internalize it. For me, I'm very determined to get well. So at that point of time, I actually keep myself open to listen to the advice from the doctors.
Breast cancer is a cancer arising from the milk glands of the breast. There are a wide variety of symptoms for breast cancer. Not every patient will manifest all of the symptoms. The most common symptom is a painless breast lump that is discovered by the patient herself. Sometimes there are no symptoms at all. In very early breast cancer, the only finding is on screening mammography or ultrasound of the breast. It's never too late to seek medical help when there is a symptom of the breast.
The cure rate for breast cancer is dependent on the stage at diagnosis. If the breast cancer is diagnosed at an early stage where it is still confined in the breast, the chance of cure can be more than 95%. When the breast cancer is locally advanced, that means that it's actually spread to the nearby breast tissue and lymph nodes. This is still treatable with more aggressive treatment, but the chance of recurrence is higher. And now we have got a lot of treatment options available that can be given to improve survival and to improve the quality of life. The treatment options for breast cancers include surgery, chemotherapy, radiation therapy, hormonal therapy, targeted therapy, and immunotherapy. With so many treatment options that are available, it is therefore very important for us to come together to derive the most effective treatment plan for the patients.
So when determining the treatment strategy for a patient that has been newly diagnosed with breast cancer, we look at patient factors as well as tumor factors. So putting together all these factors, we will come up with a treatment strategy that is most suited for each particular patient.
Communication between the medical oncologist and the surgeon is crucial in every part of this patient's cancer journey. We must first of all come together and jointly decide on the best treatment sequence for the patient, and we need to update each other on the treatment progress so that we can time the chemotherapy and the surgery properly. Post-surgery, we also have to work together jointly to provide a continuity of care for the patient.
Most importantly, I think, would be right at the beginning when the cancer has been just diagnosed and staged. When we have all the information, then I would discuss with the oncologist how are we going to treat this. So depending on what strategy we have, then there are several touch points during this whole treatment journey. So at each point, we discuss how the patient has responded and how we may then perhaps modify the treatment strategy as we go along.
So for me, it's a long treatment, but I realize that this is a journey that you need to take for you to get well. If I can turn the time back, right? I think the first thing that I discovered that I have lump, I should have gone to see a doctor. I wouldn't take it so lightly and thinking that it will go off over time. So my advice is, whenever you feel something is not right, just go and get it checked by a professional.
Simple lifestyle changes can already make a huge difference. Always eat a healthy diet, maintain a healthy weight, exercise regularly, and avoid too much alcohol and smoking. It is particularly important for women to remember to do their breast self-examination every month and go for mammogram screening starting at age 40 years old.
For women younger than 40, then they may also need to start screening at an earlier age if they have a strong family history of breast cancer. For postmenopausal women, the screening can be 1 or 2 yearly interval depending on their individual risk factors, so they should discuss this with their doctor.
I am blessed that I have a great support system. I am actually very happy. I'm actually also very grateful that I'm given another chance to live as normally as I can. Yeah.